Good afternoon. Did you know that in the US there are 600,000 knee replacement surgeries every year? And that number is on the increase. Estimates are that about 50% of those are necessary, and the other 50% don't really need to happen for one reason or another. Illustrative of that point, you may have heard of placebo surgery. You know, placebo, you take a pill, it's a sugar pill, but you believe that it's going to do something, and it does. Well, there is surgery for groups of knee pain sufferers who have exactly the same kind of meniscus tear, and one group gets surgery, the usual kind of meniscus surgery, and the other group gets a nick so that you can see where the scope went in there, and then it's sewed together. Nobody went into the joint at all. So you think you had the surgery. And 6 weeks later, you assess the people in the non-surgical group did as well or better than the people in the surgery group. So what's up with that? Well, you were looking at the fact that there is a regenerative capability of the body, regardless of whether you sew it together or not. Many people are told, oh, well, your cartilage is just gone. It's worn to nothing. It's bone on bone. If it's painful enough, we'll go ahead and give you a knee replacement surgery. So just wait. And guess what? Those people who wait and don't make any changes, that's the crystal ball proves them right. They get more pain and need the knee surgery. However, if you change something in these three categories, what do I think or believe about health and healing? How do I use my knees, my body? The knees being a microcosm of the same thing you would do about with your whole body. How do you relate to gravity in space, and how do you nourish in a deflaming type of diet? We're not going to get into that heavy, but look at the things that you can do, including morning stretches. It's another video that you'll look at shortly, which you do before you get out of bed. Things that get the knee and other joints ready for gravity instead of just popping up out of the bed. You go through this thing we'll teach you on the morning stretch video. Number two, you're going to walk with the knees slightly bent. In other words, not, but a little bit of give. We used to say, I'm walking Indian style. That's probably not acceptable language anymore, but the idea is there's a little bend and you're flexing, you're walking like a cat, let's say, very gently, not straight legs, but a little give. And also look at your athletes, your best soccer players, your best basketball players. When they're making these changes of direction, they're taking little steps, many little steps to do this. Way more effective on the field and way easier on your joints instead of trying to take big strides and go around a corner. Forget it. Of course, strengthening hands and quads, alignment, even from your spine alignment, which is going to influence the balance around the knees, ankles. Some people need orthotics in their shoes. Getting adjusted, getting this whole thing evaluated is like an eye-opener for many people. And of course, the knee decompression therapy, which is something which we use at Circle Chiropractic. We have one of the few units of knee decompression that are around in the metropolitan area of DC. So you really got to check it out. And that's another video you will refer to see the details on that. So I want to open up your thinking of possibility about prehab These are things you do before there's a problem, and you end up never getting to the point where you need not only knee replacement, but other kinds of knee repair surgery can be dealt with without knives. Be glad to answer any questions. You can detail us. Your contact information is here. It's 703-385-2990. And we'll look to see you on the field of your endeavor. Thank you very much.